Hey there, and thanks for joining us here at Smart Clinic. We want to make your occupational health experience successful. And like any good project, it's important to set a clear brief that ensures you get exactly what you need from the service. So we'd like to offer you 5 key tips on making a great occupational health referral that will provide you exactly the report that you need. Number 1, job role. This one's kind of straightforward, but we need to know what the person does. A lot of the time, it will be obvious. So there's no point providing long job specs with promotional wording lifted directly from the recruitment ad. That will just confuse things. But if there are any risks within the job role that we should be aware of, especially if we may not have been able to predict them, please do detail them. For instance, we know what a maths teacher does, but do they also drive the minibus, do playground duty, or coach the school football team? We may know what an outbound telesales operator does, but do they also deal with complaints, work nights, or supervise others? Number 2, your corporate policies. We don't necessarily need a copy of a lengthy corporate policy or an HR manual, but let's face it, there'll probably be something in there that is relevant to the case you're referring to us, so please do let us know about it. Perhaps you have a sick pay policy and the employee is about to exhaust it. Perhaps the employee is soon to hit the next stage of your absence management policy. Or perhaps you have a policy on working from the office or hybrid working that we should be aware of when making recommendations. Whatever it is, please do let us know, and we'll always take it into account when crafting a report with clinical advice. Number 3, health background and absence history. It's really important for us to know what health conditions we're likely to be assessing. This is so that we can triage the case appropriately and allocate it to a suitable clinician with the necessary expertise. An idea of their absence history will help with this too. We appreciate this isn't always possible, of course. You may not know the details at this stage. Anything you can share will help. There's no need to upload copious fit notes though. They don't tend to reveal much and create unnecessary admin for you. Number 4, and this is probably the most important one, reason for referral. There are so many reasons that you may be making a referral to us, so please be super clear on what that reason is. That way, we can ensure the report is fit for purpose. Are you looking for advice on whether someone is fit to return to work? Has someone exhausted your absence management policy and you're considering redeployment or dismissal? Is someone at work but struggling and you want a medical opinion on how you can support them? Whatever it is, let us know so that we can be really clear in our report. When making your referral, just ask yourself, what happens next? If we understand what this report is going to be used for, we can ensure it's useful for that purpose. And last of all, questions. Whatever questions you write will appear on the report, exactly as you write them, and with our answers after them. For that reason, we offer you some templated questions that are typically useful for obtaining information and advice that you require for managing your employee. However, if they don't quite fit the bill, feel free to write your own. For contentious cases, we would always suggest that you ask us whether an employee is fit to attend formal meetings. If you don't ask this, and the employee claims that they're unable to attend a meeting for medical reasons, it can seriously prolong an absence. Similarly, consider whether you should be asking us about the Equality Act. The case law around this is complicated, and often the onus is on an employer to know whether someone is likely to be covered by the act or not. So using occupational health for this can be convenient. Whatever you do, keep your questions specific and relevant. Just because you're allowed to ask 6 doesn't mean you should be asking 6 every time. So they are our 5 tips on making a great referral. Just remember, the more open and honest you can be with a referral, the better. It helps us to assess the individual properly, and it promotes trust between you and the employee. We would never advocate for having off-the-record conversations before an assessment, because this can put you at significant risk as the employer. We really hoped this has helped a little, and we'll give you a few useful prompts next time you're making an occupational health referral. We can't wait to work with you again soon. Thanks for watching, and keep smiling.